What was
Assalamu alaikum.
hello?
The communication day. First scenario, Mr. Ahmed, 27 years old male, complained of bouts of headache and palpitation for 6 weeks. The blood investigation and CT abdomen confirmed diagnosis of Pheochromocytoma. The task is to sit with Mr. Ahmed, discuss the result, and address the concerns. Yes, here you go.
Okay. Hello. My name is
Hello.
Dr. Khan. I'm one of the doctors in the clinic today. May I confirm you're Mr. Ahmed
Yes.
and you are 27 years old?
Yes.
Right. Mr. Ahmed, I'm here to discuss your health condition and update you. Is that all right?
Okay.
Okay, right. So before we start, Mr. Ahmed, can you tell me what do you know about your health condition so far?
Yes, I have a headache and palpitation now for 6 weeks, and I don't know what happened with me.
Mr. Ahmed, can you hear me?
Yes. 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 Hello. Hello.
Hello?
Hello.
Yes,
Yes.
can you hear
Hello.
me, Mr. Ahmed? Yes.
Yes. You can hear me now.
Yes, I can hear you.
Yes.
So
I
before we
have
start, Mr.
headache
Ahmed,
and feel my heart is racing, and I don't know
right,
what
okay.
happened with me.
Okay, give her a second to reconnect back, and we will start the scenario from the start.
Okay.
When she joined, we will
For
start again.
for me, my voice clear.
Yeah, it was from here, I think. Her connection was,
Okay.
yes, interrupting.
Oh, okay.
Sorry. I think I
Yes.
lost connection just
Yeah.
for seconds. Yes,
Okay.
I'm back.
You
Right.
can
So yes,
you
Mr.
can
Ahmed,
start now.
start again.
Yeah, start again, please,
Okay.
Dr. Lemus.
Right. Okay. Sorry for the inconvenience. Hello. My name is Dr.
Hello.
Asman, one of the doctors in the clinic today. May I confirm you're Mr. Ahmed and you are 27 years old?
Yes. Hello.
Your test results, is that all right?
Yes. Yes.
Okay. So before we start, Mr. Ahmed, can you tell me what do you know about your health condition so far?
Sure. I have a headache and heart racing now for 6 weeks. I don't know what happened with me. Today I
Right,
came
okay.
to discuss the result of investigation.
Right, okay. I appreciate your knowledge about your condition, Mr. Ahmed. So, based on these symptoms that you had, we have done some blood tests for you and a special imaging scan of your tummy. And I have the results with me now. And there's something a bit concerning that I'd like to discuss with you about your results. Mm. How do you feel about it?
Okay, tell me, doctor. I came to know what happened with me.
Right. So, based on these results, Mr. Ahmed, we found a small growth in the gland above your kidney. It is called, in medical terms, pheochromocytoma. Have you ever heard of it?
No, no, doctor. What do you mean? What do you mean growth?
Right. I'm very sorry, Mr. Ahmed. I understand how this must be difficult for you and frustrating. So this is a growth in one of in the glands above your kidney. It's called the adrenal gland, and this usually produces a certain protein or a hormone that helps the body to deal with stress. So in your case, this small growth releases this protein in very much amounts in sudden outbursts, and that's why it has been giving you these symptoms like headache, like racing of your heart in some instances, There's some sweating, there's some shakiness of the hand. I'm very sorry to tell you this, Mr. Ahmed. How do you feel about it?
You mean is it a cancer, doctor?
Right, I appreciate your concern. So, in this condition, it is most likely a non-cancerous growth. So, in around 90%, most of the cases are like benign, they're non-sinister growth. But as we manage your condition, then we will do like special scans to identify the type of growth in your kidney. But I'd like to assure you that in most cases, these are non-sinister growths, but we always have to exclude. How do you feel about this, Mr. Ahmed?
Uh, is it serious, doctor?
Right. So I appreciate your concern, Mr. Ahmed. So it is a manageable condition. However, if left untreated, yes, it could be serious because it might lead to some complications like increasing your blood pressure, increasing your heart rate, which might lead also to other complications if left untreated that are associated with the high blood pressure. I'm very sorry to tell you. However, we have a very good management plan for you. There will be a team of doctor, Mr. Ahmed. This includes the gland doctor, also a heart doctor that will help control your blood pressure and the racing of your heart. There's also we will involve the surgery team to look at this growth and assess for surgery and any specialty that you may need during the treatment and the plan. How do you feel about this, Mr. Ahmed?
Okay, doctor. Now,
Right,
what you will do for me? What you will give me?
right. For now, we are going to control your blood pressure. So we are going to give you some medications, which are tablets that you are going to take to control your blood pressure. And you will also be seen by the surgical team. They will do further scans to determine whether they will remove this growth and get you to surgery. And then if they like set up a day for the operation or decide to proceed for the operation, we'll have another meeting to check your blood pressure, also to give you further details of the procedure, and including like all the risks and have you to consent for the surgery. How do you feel about it?
You mean I need surgery?
Yes,
Cannot be
you
treated
might need,
only
yes.
medical without surgery.
Well,
Only
so
I take
the
pills.
well, the pill will control your blood pressure only. So this is controlling your symptoms, but not curing the disease. But we have to like the best treatment is usually to go to surgery to remove the growth as I needed. But before going to surgery, we need very careful preparation, like giving you those medication, as I mentioned, which will make the surgery much safer. So, once your blood pressure is controlled, Mr. Ahmed, the surgeon is going to remove this growth, and people mostly they do very well afterwards after the surgery.
Okay.
Right. However, the surgical team will be in a better position to discuss the surgery, the operation, and all the risks and benefits that are concerned with it, and also get you to consent for that if that's going to be the most appropriate course of treatment, of course. How do you feel about this, Mr. Ahmed?
Okay. Okay.
Right. So I understand this is very difficult for you. This must be very frustrating, and I understand that you've been troubled with those symptoms for a while now. However, be sure that we're going to do our best to give you the best possible care and get you controlled with your symptoms.
Thank you, doctor.
Right. Okay. So also one of the things, Mr. Ahmed, may I ask you a few questions?
Okay.
Okay. What do you do for living?
I am accountant.
Okay. And how are these symptoms affecting your job and daily
Yes,
activity?
doctor. Yes, yes. I cannot do my job good.
Right.
Difficult. I
Okay. So
find some days difficult to go to work.
right. Okay. So we'll get to help you with this if you need like any support, even from the occupational health worker. And are you well supported?
2 minutes left.
Yes,
Do you smoke?
yes.
Okay, so I advise you to quit smoking, Mr. Ahmed, and I can help you by referring you to the smoking cessation clinic, if you don't mind.
Okay.
Right, okay. And do you drink alcohol?
No.
Okay. Do you have any questions or any concern that I haven't answered, Mr. Ahmed?
Yes. You tell me this disease. I want to know about my children. May have the disease.
Right, okay, I appreciate this concern. So, in small number of cases, like 10% of those affected by the disease could have the disease running in families. Therefore, if you'd like to discuss this further, then I could refer you to the genetic counseling, and they will be the genetic counseling team, and they will be in a better position to discuss this and tell you whether your children have risk to get this disease as well. How do you feel about this?
Okay. Okay.
It's okay. Do you have any other concerns?
No, doctor. Thank you.
That's okay. So we'll arrange for your appointments and your medications. And if you have like any increase in your symptoms, like your headache gets worse, if you have any chest pain, if you have any like bloating, if your blood pressure goes on the higher side, then I advise you to come immediately and see a doctor. Do you
Okay.
have any other questions or concerns?
No, doctor. Thank you.
Okay, perfect. Great as usual, Dr. Ramis. Well done. Dr. Salma can comment, then I will comment.
Very good. Uh, all they cover everything: concern, empathy, sympathy, uh, introduction, and good. All is good. I didn't feel something not mentioned.
Yeah, perfect. And regarding the part of familial or the genetic inheritance, the concern was good answer. As we know, it's 10% to be familiar. You remember the rule of 10, right?
Yes.
Everyone
Yes.
knows. Yeah. So it's 10% to be bilateral, which is good thing. 10% to be cancerous, again, another good thing. 10% to be familiar, another good thing. The other part of the scenario, I think she did well from the introduction. The advices, even at the end, she remembered to give some red flags. Whenever your headache change in the character, please follow up with us or contact us immediately. For the screening, you mentioned already when she asked, but it's different than the other scenario of um, men, right? Don't mix. Sometimes few chromosomes will be included in men, right? And for that scenario, you have to screen, particularly men 2A. Men 2A. They have pheochromocytoma, parathyroid adenoma, and medullary carcinoma of the thyroid. And fortunately, they have to do, or unfortunately, the medullary carcinoma of the thyroid, it will be 100% happen with the patient who's having this cancer, or sorry, this gene in their body. That's why they do prophylactic thyroidectomy. If you have this scenario, you have to encourage for the family screening, even the adult or before the adulthood, even the children after 5 years, sometimes they are doing the total thyroidectomy. It's called as prophylactic thyroidectomy. Okay. For the parathyroid adenoma, how much it happened? Parathyroid as 50%. Sometimes also need to be surgically removed, and the pheochromocytoma will be 10%. This is regarding the men, and you have to encourage for family screening. Why? You can protect the patient or the kids or the offspring from having medullary carcinoma. Sometimes even you can do the genetic testing as a blood for the gene without doing the ultrasound as non-invasive. So the men to a one of the disease and basis, you have to encourage for family screening by doing the genetic testing, even from the childhood. Clear? Any
Yes,
question regarding about the first scenario? Any comments? Anyone has another comment? For me, she did perfect. Nothing missed. She covered all the parts, the medication. Yeah, the concern of any possibility for surgery, Dr. Salma, did you ask her? Or did she mention it? Any possibility to be surgery intervention? Doctor.
Eh, yes, Dr. Basim, you asked me something?
Yes, did you ask or did she raise the issue of surgical intervention?
Yes, is mentioning for me. Tell me we need to do surgery, we'll give Felix medication that will help in the success of surgery like this.
Yeah, so it's an option after the commencement of the medical management or the pharmacological part. The medication,
يعني
if
if not improved by medication or it is mandatory, should be done.
yes, it will be done after controlling the symptoms, should be removed.
Okay.
Okay, but we have to start with the alpha and followed by beta blocker.
Alpha blocker.
Yeah,
Okay.
phenoxybenzamine. You cannot start beta blocker only. Otherwise, there is reflex adrenergic reflection or secretion, and the patient will have exaggerated symptoms. Okay,
Okay.
Doctor. Sorry, Doctor Lamis.
uh,
Did you pose the scenario? Can you pose the scenario?
um, I'm just typing
Yes.
it. So, since we're doing disease explanation, then my scenario is hemochromatosis. So, I'll just like write
Okay. Counseling.
it's counseling. Yes. Mrs. 42 years old, Mrs. Stella. Uh, she's she having abdominal pain and joint pain and new
She's
onset
what's her
diabetes.
name?
Mrs. Stella.
Tilla. Okay.
Stella.
Stella. Okay.
Stella, abdominal and joint pain, diabetes. Um,
42
and
years.
yes, 42 years old, and she has a new onset diabetes. She has done an ultrasound, which showed increased liver echogenicity, and she has increased ferritin, and her genetic test is positive for hemochromatosis. Explain and counsel her about her disease.
After ultrasound, the oxygenicity increased. The other tool. What are the other tools of diagnosis?
So the ultrasound and then genetic
Genetic.
testing.
Yes, the genetic testing confirm. Okay. Dr. Salma, 2 minutes, then we can start.
Okay.
Confirmed. Hemochromatosis. Anyone has comment for the previous scenario?
I have a comment, Dr.
Yes.
Bassem, because
Yes,
at
sure.
one point I was thinking whether I wanted to invite or not, and then because of the like genetic implication of the disease, then I I changed my mind. So I thought, let me not invite.
Yes. Yeah.
Okay.
Yeah. As I said, any genetic condition, it's better not to invite anyone. Sometimes the patient need confidentiality earlier. Okay, at the beginning of the information. Maybe I don't want anyone to know. If she asks you, doctor, can someone to attend? Yes, you can tell her, okay, it's okay if you allow. But
Okay.
for the sensitivity of the topic of information that something is genetic, maybe she will invite her husband. Okay, maybe if you ask her, maybe she'll tell you, yes, my partner, my boyfriend, and maybe her boyfriend, if he knows about this disease, he will change his mind regarding the relationship at all, right? So you might be the one did that as a reason of the breakdown of this relationship. So it's a little bit sensitive to talk about something running in families. She doesn't want anyone to know about it unless she is the one asking about. Later on, if she already knows the disease and the condition and she wants someone to attend, she will tell you, doctor, can I inform my husband or don't inform my husband? According to her wish, you can deal with it. But as an invitation, I don't prefer to invite someone about a disease which is genetic. When to invite, I made a video, a short video about when to invite any patient or any relative. Whenever you have patient will know about very bad news like cancer or end of life care of the father or progressive disease that the patient will be end up with ventilator or will end up with a bed bound. These are the situation you can invite someone to attend. Okay, breaking bad news for diabetes, for example, long-standing disease, and the patient need to be supported with another person. Okay, but for the genetic, it's little bit sensitive. The infectious disease as well, as I said, transmitted, sexually transmitted disease in particular. You cannot say, okay, you want someone to attend to hear about or to attend this meeting. What do you think that you will talk about? HIV? You want him to know about my HIV? It's very bad to inform in front of others. So you will tell about very confidential news like from where I acquired this HIV. How you are going to tell? So the point of telling something might be sensitive for the patient. This is the idea of inviting or not to invite. I hope
Right.
it's
Okay.
clear for all.
And so it's clear.
Yeah. Okay.
Because it seems like breaking bad news, but also because it has like a genetic aspect to it,
Exactly.
then you have to be very careful.
Yeah. So it's yeah. I agree as something to support or some news need to some support from someone, but also it might be embarrassing from this person to hear or to be attended by another person who can hear this news, and it will be like not good to hear about this from the first time. Maybe later on, as I said, you can. For the palliative care, for the cancer, it's must because the patient already having something very sad. He needs support, and nothing will be confidential in this time. This patient, after couple of months or couple of weeks, maybe he will be dead. He needs someone to be with him in this journey. He needs someone to support him. Maybe even he will think about the family, the wishes. Okay, this is the idea again, as I said, for the invitation. You have any question, Dr. Lamis?
No, no, thank you, Dr. Basil.
Okay, whenever you're ready, Dr. Salma, let me know. I wrote the scenario. I'm sorry, I was writing it by myself as typing, so it takes some time. Mrs. Stella, 42 years old, has new onset diabetes. Ultrasound liver showed increased echogenicity. The genetic testing confirmed hemochromatosis. Sit with her and counsel her about the disease, address the concerns. Dr. Tani add good comment here. The Yeah, I wrote it already, Dr. Lamy. Sorry, I didn't see this one. Okay, there is also increased ferritin, increase. Okay, I think others I wrote. 2 weeks medical treatment before surgery. Yes, so if in term of duration, if you are not sure about the duration, just say we can give you medication for few days, then you will be prepared for surgery. Okay, if Dr. Tani mentioned 2 weeks, if you are sure, okay, mention it. If you are not sure, and he will ask you exactly, can you tell me, doctor, exactly? You can say after a few days. I always prefer not to mention duration or specific duration in any management. Why? Because they can minus you if you mention the duration wrong. If you are sure, definitely you have to say. If you are not sure, please don't mention it. Okay, as the duration of TB isolation, as we mentioned last week, isolation for TB, it will take 2 weeks minimum. It might be for 3 weeks, or if the result will be negative. These or those durations should be aware about them, and you have to mention to the patient. Sometimes also the patient will insist to know when exactly, doctor. Again, if you are not sure, you can ask your senior. If you are sure, you can mention it. Clear for all?
Dr. Basim, about someone to attend meeting with you,
Yes.
only infectious disease cannot be invite someone, sir.
Infectious disease, genetic condition.
Okay, even genetic.
Yes. As I said, it might be sensitive topic to be informed or heard by others, and the patient himself doesn't want them to be heard in this time because it's something familiar. It can be you can the other or as I said, the partner might decide or take a decision to build a family after this meeting. If he hear about this meeting, he might leave the patient. So it makes sense that he will not inform unless the patient himself is agreed. Okay? So don't invite at all in the genetic or in the sexually or any infectious disease. Particular in particular the sexually transmitted ones.
Okay.
Okay, ready now to start?
Yes, yes, yes.
Yeah, best of luck. Here you go.
Hello.
Hello.
I'm Dr. Ahmad. I'm doctor in the clinic today. Can I confirm your name and age, please?
Yes, I'm Miss Stella Johnson. I'm 42 years old.
Nice to meet you. We are here to discuss some issue related to your
Nice to
health
meet you,
condition
doctor.
and welcome. We are here to discuss some issue related to your health condition and address your concern. Is it okay with you?
Yes, it's okay, doctor.
Okay. Can you tell me how much far you know about your condition?
Right, so doctor, I've been feeling quite unwell for the past 1 month. So I've been feeling tired. I had a pain in my tummy. I had some joint pain. I went to my GP and he said I have high blood sugar. I was sent to the hospital. They did a scan for my liver. They also did some blood tests, and I'm here to know the results, doctor.
Okay. You have any expectation for result?
No, doctor, I'm just a bit worried about those results because it's not the norm for me. I just like developed these symptoms recently.
Okay. Your result now is with me. You want me to explain to you now?
Yes, please, doctor.
Uh, okay. Uh, the investigation results show that um, unfortunately is not as we hope that you have a condition called hemochromatosis. You have idea about this condition?
No, I never heard of it, doctor. What is it?
Okay, don't bother by name. I will explain to you. Hemochromatosis. This is a genetic condition that is I mean by it running in the family, caused by the body absorb too much amount of iron. Uh, Sometimes like from food, uh, and this is iron. It accumulate in your organ like liver, like heart, like pancreas, and every place it accumulate can cause disease and can cause damage to the organ. For example, if accumulate in the liver can cause liver sore, even if accumulate in the heart, make the heart weak and make also even can be failure and even accumulate in the pancreas and cause your blood sugar is high. You are following me?
Yes, it seems like a serious condition, doctor. I'm quite concerned.
I highly appreciate your concern and I appreciate your worry about your condition. Um, yes, unfortunately, the condition is serious, but if treated early, it will not be serious. But it is
Right.
serious because it causes damage to the organ, as I mentioned, and also cause diabetes, or cause arthritis, or cause heart disease.
Right. So,
Yeah.
doctor, do you think my joint problem and my diabetes and these symptoms are they going to be treated?
Yes, early treatment, as I mentioned to you, and I will explain to you also how we will treat. Uh, Early treatment can improve your symptom and even can prevent complication and allow you to live a near normal life.
Okay.
You you have
So,
any other? Yes, tell me.
yes, I'm just very very concerned. I wasn't expecting this, doctor. Like I was expecting like something that this seems serious. Like you're saying it affects many parts of my body, and I could have like more symptoms and things. So, you're saying it affects the
Yes.
liver. Does that mean my liver is going to fail, doctor?
Yes, everybody, not every organ in your body, not only liver. Uh, as you mentioned, this condition can cause many symptoms like fatigue and weakness, and even joint pain can accumulate also in the joint and in the abdomen, can accumulate in the liver, and even in your skin can cause sometimes darkening spot in your skin, and even
Yes,
sometimes can lead
I
to
just
loss.
noticed, doctor, that my skin is also getting dark.
Yes,
You're
all
right.
this from accumulation of iron, and even can cause sometime loss of sex desire, and can cause also some dysfunction related to the sexual issue, and also can cause, as I mentioned, heart palpitation and
But
sometimes
doctor, like
irregular heart.
you're saying my liver, I asked you if my liver is going to fail, and you're saying my other organs could fail too. Even
Yes,
if we treat,
no, no. If we start treatment early, this is can control symptom and can control nor and can live normal life.
right. So this is reassuring, doctor. I was
Yes.
a bit scared when you said that. Um,
Do you have any other concern about?
yes. So what's next? What's next, doctor?
We will start treatment by treatment is by removal of blood that will be regularly. This is
Right.
called phlebotomy. So this
Okay.
is why this one to lower iron level in your body, and this is can prevent complication and liver, heart cannot affect it. Even sometimes can give if this not get a good target of iron as a near normal iron level, in your body can also give some medication also can help.
Right,
Is it
okay.
okay with you?
Yes, it's
Okay.
fine, doctor.
Can I ask you some social question, please?
Yes, please go ahead.
What do you do for a living?
I'm a primary school teacher, doctor.
Okay. Do you smoke?
No, I don't smoke.
Okay, that is good. Do you drink alcohol?
Yes, I drink occasionally.
Uh, okay. Is this symptom impact in your life?
Yes, they are. Like for the past month, it's been very difficult because I'm having these joint pains and I'm a teacher sometimes, like I have to write on the board. So this has been a trouble for me.
I'm sorry for it, for what you are passing through. We can help you by contact occupational worker and social worker and can help you in
2 minutes
that.
left.
Okay. Uh, uh, do you have any other
So
concern?
yes, I do, doctor. So I have two children and I'm quite concerned because you're saying this is a condition that runs in families.
Yes.
What about my children? Will they have the
Uh,
disease like me?
yes. Children can be affected by 25% of children can be affected by the disease because this is
Right,
condition and are called is don't bother by name. I will mention for you. This is autosomal recessive condition. So 25% of your children will be affected by the hemochromatosis. Do you have any other
right.
concern?
And do you think it's a good idea to test them before they develop any symptoms?
Yes,
Like, look at
sure.
me,
Yeah, yes, yes,
look
yes,
at
sure.
me. I just like came with diabetes, with problems. I could have been like evaluated earlier, so I don't get this. Can my children be evaluated as well and
Yes,
tested
sure.
for?
We will refer all your children to genetic counseling clinic.
Okay,
Okay. My advising for you is to reduce iron-rich food. Okay.
right. Okay.
Um, okay. So I will give you also some brochure and leaflet and some website to read more about hemochromatosis. And I will give also my contact number. If you have any query, you can contact us.
Thank you so much, doctor. Thank you.
Thank, thank you, thank you.
Okay. Almost time is up, Dr. Salma. Thank you. Well done. It's a bit of the previous one, so we can hear Dr. Salami's comment, then I will comment.
Right. Okay. So, Dr. Salma, you're very knowledgeable on the topic. There's just few things with the scenario. Like you did things the right way, but just if you break them in chunks, it would be easier for you and for the surrogate. Because at one point, I felt it was very overwhelming, like all the information given at once.
Mhm, mm,
So initially, there wasn't a warning shot. So you said the results are not as we hope, and you started immediately.
mm,
Uh, you said about the hemochromatosis. I find it very easy, not in hemochromatosis, but in all diseases, like if it's affecting multiple, like it has multiple symptoms or multi-system, and you look at the scenario and look at the symptoms that the patient is having. She has abdominal pain, joint pain, and diabetes. So what is left for you? And she has the liver, of course. She has the liver, the diabetes, and the joint pain. So what is left is the heart, is the skin, and the hypogonadism among the hemochromatosis. So I find it easier for the patient and for yourself to say like this is a you said it's an inherited condition, it runs in family, it increases the iron in your body, which tends to deposit in different tissues, in the joints, in your liver, in the gland behind your stomach, the pancreas, giving you diabetes, the symptoms, joint pain, tummy pain, and diabetes, like the symptoms you are having now. It could also affect your heart. It could also affect your skin, leading to darkening, and you may also have some problem with the intimate relationship. And you could just ask one question apart from what you have. May I know if you have any of the other symptoms that I have just mentioned? So, like I said, I have a skin problem. Yes, doctor. So this way you will ensure
But
that you're.
is allowed to ask like history? Is allowed
No,
that
you're
to
not
ask about
asking
something?
history. You're not. You're
Yeah, it's not
mentioning all
allowed.
the symptoms, but you can like other symptoms. So you could like if you ask one question, it could help her like get an understanding. And please, Doctor Basil, like correct me if I'm wrong.
No, it's not preferred to say anything, any other symptom you have. You can mention all of them, and she will tell you, yes, doctor, I have this, I have that. But it's not allowed to ask as a question. Okay?
Okay.
Yeah,
Okay. Right.
continue. Yes, please.
Okay, so it's just like you mentioned the symptoms that she has, you confirm like the symptoms you just like told me about, and there are some other symptoms, and then you let her lead if she wants to tell you she has anything. Then I asked a question, will my liver fail? So you said yes, and the other organs, but then you said, but we will manage this. If managed, then you take your treatment, then the symptoms will be controlled and they will not fail. So I think if you like just rephrase it, say if not managed in time or with the proper treatment, this will not happen because we are starting treatment early. You give some reassurance, but the way when you mention yes, it can fail and the other organs can fail, this will be a bit scary to the surrogate. So
Okay.
that's my only comment regarding the children and the genetic counseling. Just for the genetic counseling, you can say, I will. I will send you to the genetic counselor. He will check the ages of the children and if they have any symptoms, and then he will advise you when the test will be done.
Yes.
Because
Okay.
usually genetic testing is when the child reaches 18, but then rather than going into the details, just like mention that there's an age element to it. So we'll refer you to the genetic counselor, and then he will check the ages of your children and if they have any symptoms, and then he will offer you like the right guidance or the right advice about genetic testing.
Okay.
Okay, and the treatment you covered with the venesection and the medications. So nothing else. So you can comment, Dr. Basim. I don't have anything to add.
Yes, thank you, Dr. Lamis. As I always advise, whenever you are counseling a disease, you have to start with the pathophysiology, why this disease is here. Here it's familiar, as Dr. Lamis or Dr. Salma mentioned. So it's soma recessive, means that 25% to have the disease in every kid or offspring. But 25, the patient will not be presenting with the symptoms. I want to correct that for all of you. Whenever you are mentioning 25, so means that this kid or this offspring will be a carrier. And there is a healthy one with no gene at all. Okay, so 25 to be carrier and 50% to be diseased and another 25 to be healthy. So in this way, you got it? This is for the autosomal recessive as mode of inheritance. So there is possibility.
Dr. Basim,
Yes,
25 has a disease and 50 carrier and 25 free from the disease. like this.
25. Yeah, so you have, if the mother is having the gene and the father
Yes,
is having the same gene, he should have it. Then you
yes,
can talk about this percentage. The one or one of the offspring will having 25 and he will be a carrier. There is two possibility, or two kids, other two kids, they have 50% to be diseased one, and another 25, the last kid will not have the disease at all, he will be healthy. Okay, but in case the mother is only the one having the gene, the possibility of having the disease will be very low, or most of them will be as a carrier. So in order to have a diseased one, you have to have father and mother with this gene. Is it clear?
yes,
This
yes.
this is different from autosomal dominant. Autosomal dominant, every kid have possibility of 50% to be infected or to be having this gene. But the autosomal recessive need to be having two carrier. The mother and the father are carrier. Then you have this percentage of mode of inheritance. One kid will having 25, two kid with 50%. So they have the gene from the mother and the gene from the father. Let's explain it more. If the first kid have the gene from the mother only, he will be a carrier. If the second have the gene from the mother and from the father, will be affected. The same as if the other one from the father and mother will be affected. So this is as a 50%. And there is possibility 25% he will not gain any gene from mother and father and he will be healthy. This is 25%. Okay? This is the way of
Okay,
inheritance or the mode of inheritance in autosomal recessive. So if you want to explain it more, you can say in this way, so there is possibility, but the good thing, if the father is not, if the father is healthy, the disease might not be reached to the kids, or at least they will be a carrier. When they will be diseased, whenever or affected, whenever the father and mother are affected. This is regarding the mode of inheritance, and you answer it maybe little bit correct. But if you are talking in details, you can refer to the genetic council, so they can help you in this. The age of screening, as Dr. Lamis mentioned, it's 16 and above. Okay, this age, whenever the adult can take a decision either to do screening or not. But earlier, if the mother insists, you can tell her, we will refer you to the genetic counseling. There is no benefit to start screening now. Okay? Let's go to the other topic or the other point, the alcohol. You didn't address the alcohol here. Do you think it's important to stop alcohol?
they mention occasionally.
Even
That is mean
occasionally.
no.
You have risk now
Okay.
that the liver will be already full of the iron and the risk of being cirrhotic more than the other population. If you add another risk, which is alcohol, so the risk of cirrhosis will be higher and higher, right?
Yes,
So better to stop it at all. The same for the first
yes,
scenario. Dr. Lamis asked you about smoking, and she said, I ask you to quit smoking, but you don't know what amount she has and if she's agree or not. Try to,
okay,
Yes.
to know, yeah, try to ask more. How many, for how long? Okay, because after that you can say, yes, any amount of smoking are hazardous, and in order not to have cancer or other conditions which is serious for your health, I advise you to stop smoking. If you don't have time, as you said, yeah, if you don't have time to address and to ask more, maybe at the last minute and the last thing you can discuss the smoking, okay, you can tell her, I advise you to stop smoking totally because it's harmful with any amount. But if you have time, you can ask for how long and how many. The same as for alcohol. How many are you aware about the amount, social limit? No, doctor, I am not aware. So you can tell her 14 units per week. If she is agreed and she's exceeding, I can advise you to cut down this alcohol because it might harm your kid liver in this scenario in particular. But In general, you can moderate your alcohol intake or consumption. This is
Okay.
regarding the second. Yeah. Let's go back to the topic itself. How to cancel about disease. Starting by pathophysiology here, mode of inheritance, familial, runs in family. The second thing, the manifestation, how the patient will present with and why it present with this. As you said, it's a deposition or accumulation of the iron in different or certain organs, brain, liver, heart, kidney, and pancreas. After that, you can explain what you are talking about. So in the brain, you might have some hormonal or other glands deficiency. In the heart, your heart might be weaker than usual. In the liver, try to make it very simple and very short in the explanation. Don't explain more. In the liver, you might have liver scarred with the time, and your liver might fail. I'm so sorry to say that. This is the case now, hemochromatosis, okay? And the pancreas, the gland, the tummy, also can lead to the diabetes, high blood sugar, or the gland responsible for the fertility. I'm so sorry, even you can have some difficulty to have a baby in the future, or the impotence itself. So you cannot have good relationship or intimacy. Sorry for this. Okay, these are the manifestation in 2 minutes, not more than this. The complication, yes, could be failure of the liver, failure of the heart, failure of the glands, complication of diabetes, even the medication itself. The iron chelating agents have some complication you have to mention. Okay, this is
Okay.
the way of the complication, how to address the complication. The last thing, the management, pharmacological non-pharm, as we know. So you have to know, to be aware about not to take any iron. This is the very easy advice you can give to any patient with hemochromatosis. Some patient will take iron for correction of anemia. Those people, they are at risk to having more hemochromatosis if they are taking iron, right? So avoid any iron intake. Apart from this, you can do some venesection in the term of removing some of your blood, and it cannot be for donation. This blood will be like not good for others, not healthy. The pharmacological option will be some iron chelating agent, so some medication called iron chelating agent. I can arrange another meeting with you to know more about this medication and what are the possible complications. Don't forget the complication of medication. Okay? It can be
Okay. If
arranged
there
in
is a time,
another
يعني,
meeting. No,
should
not
I
in this
mention
scenario.
side effects?
Not
Okay.
to mention the side effect, but you can mention at least the term of the medication, what the name of the medication. It's called iron chelating agent. Why you are saying
Mm.
that? Because you are showing the examiner that I give him or I give her the pharmacological option. This is part of the clinical judgment. So you are aware about the topic. Don't explain what else. You have to say that's the group, and we will arrange another meeting to know more about this medication, how to be taken, what the side effect possible to happen, and how to what the precaution, what the interaction. Okay.
Okay, because this is another task. It's not mentioned
Of
details
course,
about.
yes. No, no, it will come as one task, either this or that. So counsel about management or counsel about the result. Okay, and I prefer to whenever you are saying breaking bad news to say I have concerning news because you are having some discrepancy. You are saying breaking bad news or it's very bad news. Then you told her you can live near normal life if you take the medication early. So don't be as doing conflict or making a conflict to the patient. It's very bad news that it can lead to scarring, but you might live near normal life. The best way I have concerning news. Okay.
Mm.
In order to prevent the complication, we can start the management early. But are you sure? Do you have any guarantee that even with starting medication, the complication will not happen? You have any guarantee for
No,
that?
no, no,
So,
no.
yeah. So it's concerning news. I am not sure if the medication will have the effect. Maybe It will have good effect. You might live near normal life, but I am afraid to say even you might have failure of the liver, and the definite management here will be Dr. Salma. What the definite management of hemochromatosis?
phlebotomy.
No, no, definite management of liver. Sorry, it's liver cirrhosis after hemochromatosis or hemochromatosis complicated by liver affection.
Transplant, you mean?
Yes. So you are not sure if he will be at the end stage, chronic liver disease stage. You don't know at what stage he's presenting now. Okay, so don't say you will be living near normal
Mm.
life unless you have the diagnosis early with good response to the medication. Okay,
Okay. So the answer here will be prevent complication and control symptom.
exactly.
All. Okay. Okay.
Okay, and
Okay.
the I'm not sure about the outcome of hemochromatosis, the cure, but it's not curable. What I believe,
No, no,
it's
no,
not
not
curable.
curable.
Yeah.
Mm.
So yes, we are trying to help you to have symptom free, but we are not sure that you might be as clear of or cure from this disease. Okay. The complication we mentioned, the management, then the concern, then the social, the job. You ask about the job, right? Yeah, and the impact on the job. I think this time you did perfect than the previous one. This is my comment. If you have any question or comment, you can add.
Thank you, Dr. Bassem.
Okay. Dr. Lamis, you have any question or comment?
No, not at all. I think just one
Yes, sure.
thing. And, Dr. Salma, she did really great. It was just like rearranging the flow of the
Yes,
scenario. She has all the knowledge. She's very knowledgeable on the topic. So the team of doctor, the liver doctor, this is important. The liver, the gland doctor, the heart doctor, the joint doctor, and offer the women's doctor because this has like two elements. As I mentioned, one of the symptoms it could be some issues with fertility
perfect.
because
Yes,
of the deposition. So, if this is an issue for you, I'll refer you to the women's doctor. And if you plan for like any pregnancy in the future, you also need to discuss it with the women's doctor. So, I think that's the comment I forgot to say.
perfect point. Thank you for adding this point. Whenever you have a female in your communication or long scenario, please put a circle on the gender and the age. If she is in the childbearing age, talk about pregnancy. Put it in your task. I have to speak about pregnancy. Okay? Not only pregnancy here is important to be planned, even for the future, for the planned pregnancy to be safe. As we know, the genes comes from mother and father. If you want to have a safe baby with no hemochromatosis gene, you can do over selection. So it's a matter to even do genetic counseling and genetic referral to have a safe over and safe baby by referring him or them to the genetic counseling team. If they do have kids, now you can do the screening or encourage whenever the age more than 16, then you can give the option to the kid to have or to the offspring if they want to be screened. But encourage for, okay, to start the medication earlier, to do screening, to do follow up for ferritin and transferrin level. I hope it's clear. It's very important whenever you have, do it as a habit. Whenever I have female, I should put a circle about around the gender. Female, I will do arrow. I will draw an arrow pointing to I have to speak about pregnancy. In the communication, I have to do so. You'll be lucky if you have male, okay? But in female, you have to speak about them. Clear for all? Any
Yes.
question, Dr. Lamis or Dr. Salma?
Uh, about alcohol.
Yes.
Uh, in when the patient mentions that occasionally, we will stop occasionally, even if less amount than 14 units in
Yes,
all
so
case, or mainly because this is the affect liver.
yes, perfect. In liver disease only, chronic liver disease, I have to stop.
Okay,
Okay. Other
okay,
condition, moderate your intake.
okay,
If he knows about the social limit, so you can advise him to be within the social limit. If no liver disease is there, if there is liver disease, cut down the alcohol at all.
okay, okay.
Okay. Any other question or comment? Anyone want to add any question or comment before ending the session? Okay. Satisfied all?
Yes.
So we can wish you a happy weekend. No session tomorrow, Thursday or Friday. So we will resume the activity on Saturday as every week. Have a nice and happy weekend. See you, inshallah, on the Saturday. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you.
Thank you too.